How to better detect melanoma in patients.
Thank you very much. Can you hear me well? Great. So actually I'm not speaking German at all, but I understand few words like Gesundheit and digital health, digital experts, digital solutions, and I think we fit to the same area. I'd like to introduce you to my family. A few years ago, my father was diagnosed with melanoma, the skin cancer. Then I realized that he, me, my brothers, my kids, became to be part of the high risk of melanoma. And not just us. I realized that more than 420 million people around the world are part of the high risk of melanoma. Also, 250 dies every year. And there is no cure for melanoma. So the only way to do is early prevention, early detection of melanoma. Also, we found that in Germany, this is the national cancer. In UK, they spend more than 600 million euros to treat melanoma, and in the States, more than $8 billion to treat the skin cancer. And it's cost a lot of money. If you're talking about insurance, it's cost the insurance companies, the HMOs, or the federal institutes more than 120,000 euros to treat someone that was diagnosed with melanoma. In Germany, this is one of the only places in the world that they adopt the early detection. It's called TBP, Total Body Photography, in Schleswig-Holstein. And in a few years of researchers, they found that actually it helps. They increased the mortality more than 50%. It's amazing. And they found melanoma in more 90% in the early stages. And you know, the early stage, as a physician, you know, it's 2 minutes to take off, send a biopsy, and that's all. The problem with melanoma that 60% from melanoma started from new mole on the skin, and the other 40% from mole that have been changed. So let's track the changes, and let's find melanoma in early stage. But the problem is that the human body is very dynamic. We're always moving, we're taking a breath. After a year, we're getting fat, we're getting thin, a pregnant lady. So that's the problem. Let's play a short game. There is more than one changes between the two pictures. And I promise you, who will find all the 5, I will pay him my salary. Let's find. If someone will find the 5, my salary is promise-free. I help you, you can't. You really can't. Yeah, you saw those, this is Tel Aviv from air. Those 3 buildings are 75 high floor buildings. So it's easy, but there are more than 1, as I said. There's 5. It's really hard. Now think about the dermatologist who trying to find a 2 millimeter mole. It's unavailable. What we saw here, it was auto-diagnosed and auto-compare with military tools that using by the Air Force, by the intelligence services. So we adopted the same technology from defense to save life. Based on the same technology, we developed EDC, Emerald Derma Compare Solution. And the idea is keep it stupid simple. Use a very regular tools that everyone got on his pocket. Use the regular smartphone, as we saw here before. Use a regular camera that you can buy outside in 600 or 700 euros, that's all. Let's take the photos and let's use our application. Emerald application just launched a few days ago. The idea is log in, put your details. We collect a lot of information, like where you've born, what is your skin color, how many moles you got on your body, where are your parents from. In a minute I'll explain why, but it's very important to understand why. As you see here, this is the total body photography map. This is the golden standard. Take the photos via the smartphone. That's all. Use the smartphone, take the photos, upload them in the same positions. As you can see, example from one of our clients. This is for the home user. When the home user is taking the photos, now this is your turn. the dermatologist or the GP or any other physician will turn to the PC, will use his PC, user, password. You will see all your patients list, and then you will get what you need to see, the differences. The yellow are moles that haven't been changed. All the greens are new, moles that have been changed. That's all. We can't and we don't want to say more than that. We're going to show you what are new, what have been changed. You as a doctor will take the decision what you do with that. We are a helping tool, we are a decision support tool to help you. We don't know what is melanoma. We even don't want to know because we are not an analyze tool. We want to be a decision tool for you. We can help you with more information. We can upload a dermatoscopy photos and then make the comparison between dermatologist photos. Also, we know to take the measures. So we know that melanoma is A, B, C, D, asymmetric, border, color, diameter. We know how to take the measures and then tell you, okay, look, this one is bigger than others, this one got 2 colors. We based on the ugly duckling algorithm that was announced by Professor Alpern from Sloan Kettering. We know how to treat as per the ugly duckling algorithm. We can take the measures of the mole and then help you to take the decision what to do with that. We're based on the cloud. We are a digital health solution. We're based on the cloud. That means that we can collect a huge amount of data from all over the world to one big data. And we're using very sophisticated analytic tools to realize which kind of mole might be suspicious or which kind of mole maybe one day tend to be melanoma. That's why we're collecting the data. We know that someone with bright skin, a lot of moles that living in Australia or North America or even in Israel is part of the high-risk population because the sun, bright skin, it's not working together. So we know how to do the calculation and put the finger on a suspicious moles. So we're collecting the moles from everywhere. We know which moles was diagnosed with melanoma. So if someone from Germany will take the photos, we can help, we can help to make the compare not just year after year diagnostic, even the ABCD algorithm, and the most important, based on the crowd, based on the wisdom of the crowd, we can help to find the suspicious moles. Of course, it will be more accurate, it will be low cost, it will not spend the time for the physician. It will be, all the photos will take at home. We don't need to ask the patient, come here, take your clothes, take the photos. You can do it at home. And of course, it can increase the turnover of the physician. It's something that it will help the physician from one side, and it will save a lot of money to the health insurance companies from the other side. This is a competitor table. I can save your time. We are better than all the others. You can see us later outside on the brainworks. I can explain and show even why and how. The business model is very, very simple. We are not going to sell any equipment. As I said, we based on your equipment, regular camera, regular smartphone. What we're going to charge is, as you saw before, we talked about 120,000 euros treatment cost, so we can save it. So our idea is to charge 75 euros per year per patient. That's the idea. One-time fee per year. And if someone is part of the high risk, we can take a lot of pictures without any charge, just once a year per patient. For now, we are still now, we were a bootstrapping company. We just get funded, not very, just in the last few weeks. We developed the application, we developed the clinic solution, we developed the app for the patient solution, and now we are aimed to start go-to-market here in Germany. We were part of the Axel Springer Accelerator. Axel Springer is one of our investors. I met with Jessica there, and we had a lot of experience here in Germany. We found the market is ready because you did it in Schleswig-Holstein, as I understand, is something that is going to be at the federal rate. Hopefully, we'll start to work with you here, with the insurance company. We already met a few dermatologists, a few hospitals like Charité. I think we can joint venture here in Germany. We even won a few prizes like the Orange competition and the Best of the Best up for 2013. EDC is early detection of the skin cancer. Actually, this is the ABC of saving life. Thank you very much.
So, thank you, Lior, for this presentation on the emerald application to better detect melanoma. Do you have any questions to Lior Wayn right now here in the grand public? I might add that as an example what we as an insurance can do for young startups. You found your way to the Charité department to talk to them how to apply your invention in Germany, and then we provided to you 3 dermatologists we know who are interested in trying and checking out and giving you a feedback whether it works or not in a German environment. Mm-hmm. So this is one way, among others, where we are implied in accompanying or helping, supporting you developing the business idea.
Actually, yes.
Bitte.
It's quite an interesting method, but as I understand, it's a screening method.
Yeah.
We've applied the very same thing for intraoral lesions in odontology. We have now a network where dentists can send to us pictures of differences in the oral mucosa. Then we will answer and say, okay, according to your photograph, we may say, but please be sure we cannot guarantee the diagnosis. So what you can do, as I understand, you can tell them, look, this seems to become a melanoma, see your local dermatologist. Is that right?
Exactly. Actually, we are not even say it will come to be melanoma. It looks like a new mole or mole that has been changed. First, let's go visit your dermatologist.
Okay.
And please show him the pictures. It will be very helpful for him, because we found that there is no historical photos that stored anywhere.
Okay.
So that's the idea, to keep the same rule.
That was my understanding too, that it's a dermatologist, and that's the doctor, the physician, as you were pleading for. That's the dermatologist doing the final analysis and diagnosis, comparing those 2 kind of pictures a month ago and today, and in 6 months in the future. So still, at the center of the diagnostics is still the physician, and the tool and the technology is just assisting and supporting in it.
Absolutely.
Yes. Yeah, you were first, and then you.
With respect to your business model, you didn't tell us who do you expect to pay the fee? Is it the patient himself? Is it the dermatologist, or is it the insurance company, or do they just throw the money together?
Hopefully the insurance company, because I think it will save, it will like, there will be any kind of reimbursement. In the American market it's working like that there is reimbursed by the HMO, party out of that, and the rest paid directly by the patient. Also it depends how high risk he is. If he got more than 100 and more, and his father suffered from melanoma, I think this is the incentive for the insurance company to send him to do the checkup.
One little question. Did you take into consideration to address that what the colleague said before, to transfer it to the physicians, to the dermatologists? Because our experience is the market will be less broad. Let's put it that way. If you try to address the patients by itself, the other opportunity would be to go to the physicians' associations and to try to get it in the regular finance system.
I think that, let's say that I believe that my father will go to the clinic to take the photos and all the scenario. I believe that me or my kids will do it at home. Actually, the shame that not everybody like to take his clothes off, even, in front of the dermatologist. But sometimes there is no other choice, so maybe it will be easier to do it at home and start all the process at home. And I think it's something that we saw here, and we will see more and more, that all the technology changed our life. I think a lot of, there's in Israel there's a few HMOs or insurance companies that found that it's easier, cheaper, and more effective to send even chronic sufferers to home, and they can treat them with the smartphone or with any other mobile. They get even a better treatment at home because the nurse, it's one button press from service. And also I think that all the digital solutions will change our life. And I think that time after time, more people will take it home, the photos, and will come to the physician with the photos to save the time. Look, fine, tell me what is it.
My understanding was that, that maybe the photos are taken at home, but still and always the diagnostics and the analysis and the comparison between before and today will be always done in the dermatologist's office, where he will look at those both pictures.
Exactly, because you can even find, a mosquito bite as a new mole, but it will be, someone will be afraid from that. We know that the dermatologist will know what is it, so it will be in the clinic.
Professor Wayn.
Well, all the screening systems we have in medicine are getting challenged occasionally. And this is not only related to the credibility of the doctor who may want to make some money, but also it's a question of scientific evidence, of sensitivity and specificity. I could imagine very well that I know many dermatologists in this country that they challenge you, if they don't share your enthusiasm, about sensitivity of homemade pictures in comparison to a check of a really well-trained German dermatologist.
I think you're right. First of all, you're right. Second, I think it's time. It's a question of time. Because a few reasons. First, our smartphones getting better and better, so the pictures will be more and more better than after the time. Second, the algorithm, it's a machine learning and artificial intelligence based. That means that, and a good example I will show you later when you come to visit us outside, there's a good example that sometimes the auto comparison find a mosquito bite as a new mole. But you as dermatologists will remove it. You and all the others, so after 1, 200, 2,000, the machine learning will understand, okay, something red, that this is not exactly a mole, this is a mosquito bite, everyone removed it, so automatic, I will not show it. So the artificial intelligence will learn from the crowd. So after a while, even the patients will move, even the photographer will move, maybe the quality will not so good, but the quality of analytic will be better. So I think time after time it will be more and more accurate and more effective for dermatologists, and not just for dermatologists, even for general practitioners. You know that in the United States, most of the people doesn't live in New York, Boston, Philly. They're living in the small villages, so they only see their GP. So we want to have the GPs in the United States, Canada, Australia, or even in the UK. In the big UK, there's only something like few hundreds of dermatologists, that's all. It's not in the community. So we think about a huge solution.
Thank you very much for your answers and for your questions. I think now it's time to have a coffee break, and after, let's say, a quarter of an hour, you will be asked by a gong to join the group of the color that is on your, was ist Ihr Namensschild? Here inside is red and your color is blue. Das ist das im ersten Raum draußen. Und im zweiten Raum, da wo Sie sich akkreditiert haben, da ist das ist dann Ihre Gruppe, dann die Grüne, Herr Jakobait, wo die Möglichkeit dann besteht, Viertelstunde, 20 Minuten in einer kleineren Gruppe mit dem Experten zu diskutieren. Jetzt erstmal eine Viertelstunde Kaffeepause.